Welcome to the Norton Healthcare Healthy Hour. I'm Abra Sickles.
And I'm Keidra King.
We are thrilled to kick off the new year with all of you. This is your go-to monthly series where we explore tips and tools to live healthier, happier lives.
January is all about new beginnings. So today's theme is New Year, New You. We're focusing on two key areas, nutrition and fatigue. These are challenges many of us face after the holidays, but don't worry, we've got expert advice to help you start strong.
And remember, later in the show, we'll answer your questions and share free resources you can use right away. So grab a pen and your phone and let's dive in.
Let's start with the topic that affects us all, nutrition. It can be hard to make healthy choices after a season of indulgence, but small changes can make a big impact.
Here to help us is Executive Chef Teresa White at Dare to Care and Annika Sizemore with Norton Community Medical Associates, West Louisville. Welcome to the show, guys. We are so happy to have you.
Thank you so much.
Thank you for having us.
So Chef T, I wanted to start with you. I know you have 15 years as a healthcare chef. So can you tell us or give us some ideas about setting realistic nutrition goals?
I think it's really important not to try to tackle everything all at once. I really don't like the way diets are structured. They're structured to take things away from you. Now, if you've got a health concern where you need to be mindful of those things, that's one thing. But if you're just trying to lose weight or live a little healthier, take things in baby steps. For the first 2 weeks, instead of taking anything away from the way you diet or exercise, instead choose to add something. Maybe you're gonna make sure you get 32 ounces of water every day for 2 weeks. And then the next 2 weeks, you add 2 servings of vegetables. And the next week, you add a serving of whole grains. And by the time you've added things into your diet, one, the things that you are craving to have because they've been eliminated from your diet, you're not fixated on those things anymore. But now you're finding that those cravings are dissipating. You're finding that once you've started adding all these things into your diet and now you're taking an extra lap around the block, now you don't really have room for all of those things. And I just feel like it's a much more sustainable way to build a healthy lifestyle and to build healthy habits.
I kind of want to dive into a little bit of the misconceptions that are surrounded with nutrition and just some of that education.
I think portion distortion is one of our biggest factors in being healthy and sticking to whatever eating style we've planned for. You know, Americans, we love big portions. Our restaurants like to demonstrate that they're giving us a good bang for our buck. But a lot of times on our plates, what we're actually seeing is 2 or 3 meals worth of food on a plate. You finish your plate, you're feeling good, you feel like you got your money's worth, but what you've really done is eaten 3 meals at once and didn't even realize it.
Oh, man, I tell you, I think it's really easy to sometimes overeat, as you kind of talked about, just that portion size, and we kind of already have, already a lot of these misconceptions of like, more is, better, but sometimes it's not. Annika, I kind of want to go to you from a provider lens. What are some things that you are discussing with your patients, especially when it comes to nutrition and just how that affects overall health?
Okay, I like to discuss with my patients, first of all, the 4 food groups, fruits, veggies, protein, and your fats. You want to incorporate that in your diet, each of your meals. I stress eating 3 meals a day. If you can't eat 3 meals a day, eat 5 small meals a day. Just eat it in portion controls. You don't want to get a big plate of pasta and then a little bit of veggies. You want just a small thing of pasta and then a lot of veggies. You just have to be mindful of what you're taking into your body.
So it sounds like from what I've heard from both of you all is being mindful of what we're intaking. And I know for me, at times, I can think I've only eaten like 2 or 3 chips, and then I realize, oh my goodness, I've eaten a whole bag of chips.
I'm guilty too.
And so I love what both of you all said about being mindful about what we're eating.
Kind of one thing that I want to say is, as we ask our viewers as they walk away and what they're, watching today, what is, from both of you, maybe one solid tip of advice that you can give them kind of shooting into the 2025 year and kind of setting those healthy habits? What's one good thing from a nutritional intake that you can give them?
I think that most of us are not getting enough fiber in our diets. Mm-hmm. So if you really want to make a really strong impact and really make that one of your first baby steps. I think women are supposed to be getting 28 grams of fiber per day. Gentlemen are supposed to be getting 34 to 35 grams of fiber per day. I think that's where I would start.
And also proteins. Proteins, they keep you full as well.
That's great. That's great. That's some really great resources and tips and everything. I feel like I've learned a lot, and I can definitely take this away and maybe start incorporating just some of these great tips and tricks just within my own diet. So I'm really excited. You know, health is on the forefront for me this year for 2025. So I'm definitely excited.
And I like that they're doable steps, right? And
They are.
setting manageable goals.
We are excited that you guys came on, and we're looking to take some of this information and go forth within 2025 to make stronger nutritional changes in our lives. Now let's talk about fatigue. Feeling tired all the time can really drag us down, but there are ways that we can boost your energy. Joining us today is Dr. Melinda Ruberg, Medical Director for the new Norton West Louisville Hospital. Welcome to the Norton Healthcare Healthy Hour.
Happy to be here.
So I'm really glad that we're talking about fatigue. I feel like it's an underrated topic that we really don't talk about in the community.
I like to break it down into, is this acute from a recent illness, or is this more chronic that we're dealing with? And both of those things, when we talk about it, take time and patience to discuss with your provider, two things that are a hot commodity in the world that we live in. And so when we're talking about chronic or acute fatigue from a recent illness, it takes time. And so I think we underrate how long it takes for our bodies to recover. If you're talking about someone who is just in the ICU, you lose about 2% of your muscle mass a day in the ICU. They did a study on COPD admissions where patients are losing 8% of their body mass just from that admission. And so that takes weeks, months, sometimes years, depending on where you're at, to recover from. Even an acute illness like a virus, we think 2-3 days, I'm back at it. It's more like 9 to 14. And then you have to take into consideration things like long COVID.
Oh, wow.
So we know about long COVID. We know that the best treatment is counseling and physical therapy, essentially to help your body and your mind process what you're going through. But when we researched this where I trained at OHSU, we found that our discussion was we're probably underdiagnosing this for other viruses. The only way that we found it in COVID was because so many people got it at one time that we were able to evaluate the post-virus response. So that's from an acute illness. It takes time for us to recover. When we're talking about a chronic fatigue, that's when you want to look at your most common causes. So you always want to get a basic lab workup, your vitamin D, your B12, thyroid. I'll be honest though, vitamin D and B12 alone are probably not what's causing your fatigue. And so you want to make sure and rule those out to start with. You also want to, if you're a woman especially, you want to check your ferritin. There are very good studies that even without anemia, low ferritin should be treated with oral iron. And if you can't tolerate that, I encourage patients to advocate for IV iron because sometimes that can be a major boost to your system. Those are the major lab things that we want to look at in addition to looking at your hemoglobin for anemia and your white cell counts to rule out anything cancer related. The main thing we want to look at is, do your labs look normal and are you up to date on your routine cancer screenings? If both of those things are true, it's probably not cancer. There's no need to do a head-to-toe scan to make sure that there is nothing hiding inside of your body. The next thing I look at, and this is what we talked about before, food is medicine.
Yes.
Sometimes I can look at a patient and I know them because I'm their primary care doctor and I can say, hey, what you're putting inside of your body in terms of food, energy drinks, and lack of sleep, your body has no chance at having energy.
Yeah.
The two most common causes, sleep apnea, which is very underdiagnosed, and lack of sleep quality. So when we talk about sleep apnea, the average rate in the United States is about 13% in men, 6% in women. So it's high. When we look at self-reported data from Kentucky, it's about 14%.
Wow.
And so that's self-reported data. That's not data of undiagnosed sleep apnea. So my guess and what I see in my practice is that's probably much higher. And so we need to be screening for sleep apnea. If you are snoring, if you are feeling tired, even sometimes if you have a like specifically formed chin, you need to be ruled out for sleep apnea. The other major thing that we talk about is depression. So diagnosed or undiagnosed, this has a toll on your body. Stress, PTSD, trauma, all of this takes a toll on your fatigue and is worth discussing with a professional to talk through how to process that better.
Nice, nice. You brought up a lot of great points from, a medical side. And one thing I'm kind of curious about is in an age of technology, we have all these devices, watches and smartphones, tablets, all these things. And so do you also think maybe increased use of technology plays into fatigue, maybe sleeping with the TV on or anything like that?
So research shows us you must be without a screen for an hour or two before bed.
Okay.
Interesting.
Which is difficult because we use it for everything. It's my alarm clock. It's my reminder list. But even plugging it in, get an old school alarm clock and plug that phone in your bathroom. Wow. And it will do a miracle for your sleep quality. There's the blue light filters that you can also use. They're helpful, but as much as we can physically separate ourselves from screens before bed, the better sleep quality you're going to have.
What can we do to improve our sleep quality? Because I know for myself, it takes me a while to go to sleep. And when I go to sleep, I feel like I'm really good. But since I've started wearing my smartwatch, it's telling me that I have more hours of light sleep versus like deep sleep. I think it says my deep sleep is only like 40 minutes versus like 6 hours of light sleep. So what can I do or our public can do to improve that?
So one thing that I always talk about with patients is sleep is only for sleep. So if you're not falling asleep, I know it's hard because you're cozy and it's really cold out right now, but you have to get out of bed because you want to train your mind that when I am in bed, I am only sleeping.
Okay.
I'm not reading in there. I'm not doom scrolling on Instagram. Like I am there to sleep. That's one thing. The other thing that, again, this is Kentucky specific, Kentuckians, there are only 15% of us that are getting the recommended exercise that we need. Wow. If you are not spending energy, your body doesn't need to recover from it. And so that recommended exercise is 150 minutes a week. That's a lot of aerobic exercise.
What is that a day?
So that's like if you work a Monday through Friday job, 30 minutes a day, Monday through Friday.
Okay, that's doable.
Yeah.
Okay.
Yeah. So that is the biggest thing. You need to use energy in order to restore energy.
Okay.
And as we talk about too, I am really big from a stress management. How can I de-stress? It's really important to kind of have that balance in life, but really kind of go into more of like what stress management can do to help combat fatigue.
Yes. So when we look at evolution, our bodies really have not caught up to the level of stress that we deal with every day. And so that's why we have to do more to combat that. One of the ways that you can do that is by removing technology. This is proven to increase stress, especially social media. The other thing is regular meditation. And so there are plenty of apps out there. Some cost money, some are free. There's a variety of ways that you can approach it where you have a daily meditation or gratitude process so that you can really start to process that stress and micro trauma that you deal with every day in the society that we live in. And then there's also, of course, counseling.
And what I appreciate that you're giving us, there are small changes that have big impacts, kind of what we talked about earlier. So having that quiet time to meditate or pray or whatever you do, whether it's in the morning or in the afternoon, exercising, whether that's walking and getting out, like these are things that we can incorporate in our lives gradually. So I really appreciate you saying that because in my mind, I'm like, okay, what is it that I need to do, right? And I'm thinking there's this big answer that I need. And they're really just simple things that we need to incorporate back into our lives that I feel like I used to do when I was younger, but life happens and we get busy and we forget to just take care of ourselves.
And that's the patience part.
Yeah.
So we're talking about habit changing,
Yeah.
which does not happen on January 1st overnight. It happens over months and years, really, to figure out how to be your best self.
Yeah.
Such great, topics just with fatigue. And so hopefully, our viewers have gotten some really key nuggets here as they take that back and kind of take that back into their lives.
To their everyday lives. Yeah.
Absolutely.
Yeah. Thank you.
Yeah,
Thank you so much.
This was fun.
We hope you feel inspired to take these first steps towards a healthier, more energized year. Don't forget, Norton Healthcare is here to support you every step of the way. Check out nortonhealthcare.com for additional resources and to learn more about healthcare services. Thank you for joining us here today. Here's to a healthier, more energized 2025. See you next time.